Hi everybody, welcome to another episode of Nurse Tracy Unfiltered, and we have the amazing Dr. Alexis MacDonald with us today. So could you explain some things to me and everybody else out there? What exactly is GUSM?
Absolutely, I'm so glad you asked. So GUSM is a term that stands for the Genitourinary Syndrome of Menopause. And this term encompasses all of the changes that occur to a woman's vagina as they go through menopause. The AUA, the American Urologic Association, the Menopause Society, and two other groups have actually partnered over the last 6 years to come up with guidelines in order to treat this syndrome. This used to be called vaginal atrophy, and there was nothing that could be done about it. We now know that vaginal estrogen is not only safe, but it is effective, and there are no contraindications. So that includes patients that have existing or past history of cancers, including breast cancer. There's absolutely no contraindication to vaginal estrogen. There is a lack of awareness and a lack of education on the provide of a lot of clinicians. But hopefully that this guideline that was just released in early 2025 will help unify and educate clinicians and patients about what their options are. Lubricants and other things that we use traditionally to treat GUSM, they're Band-Aids. They're not necessarily solving the problem. This condition in GUSM, it's going to happen to every woman that enters menopause. The itching, the dryness, the loss of tissue, the lack of good fluid, dyspareunia. The most important thing is increase in UTIs leading to huge mortality. So the treatment of GUSM is essential to prevent recurrent or urinary tract infections in the elderly, which leads to sepsis and death and ICU mortality. So all of this very, very, very important part of women's health needs to be addressed. It actually doesn't even really require a physical exam. Diagnosis can be made just on a woman's self-reported symptoms. And with that, we can make a diagnosis and adequately treat. It is my hope that with this, we can increase education and information and awareness to both patients and clinicians alike so that we can kind of tackle these menopausal issues and improve women's health. That's the most important thing. Awareness, education, and improvement in women's health.
I am so thankful that you came on today because every woman has those symptoms, and I think at a certain age.
For sure.
I am so excited, everybody, to get this out there. Now, if anybody wanted to be treated or talk to you about this, where could they find you?
Absolutely. So they can call us at any time, 315-216-7100, and also visit our website, which is www.gmwcare.com. I look forward to seeing you.
All right, everybody, all you ladies out there, click, like, and share. See you next time.